If you're having problems with stress, an important step in feeling better is to take an honest look at your lifestyle.
So, for example, if we find that stress is making one's high blood pressure worse or ulcer more severe, then we review with the patient what aspects of their lifestyle is stressful. If we can reduce the stress in their life, it will improve their medical condition.
Stress from his fast-paced job was making Larry Gates' blood pressure, which was already high, go even higher.
I want to put a quick hold on this.
What we might want to consider for you is...
Larry's internist convinced him to make some lifestyle changes and to slow down.
I do try to take it easy and try to exercise and diet and take my time in my decision making, take my time in walking, take my time in even going places.
And over the years that I've seen him, his blood pressure tends to be better when he's doing more relaxing activities, and his weight is better controlled when he's exercising more and under less stress.
Okay.
People experiencing problems from stress may also benefit from various types of relaxation techniques, such as muscle relaxation or deep breathing, or from another technique called biofeedback. Biofeedback helps people learn how to regulate some bodily processes they don't normally control, like the temperature of the skin.
I can feel the blood going down from my head and into my hands in waves, and my whole body is relaxed and warm.
Karen Malke, who has stress-related headaches, is learning how to increase the blood flow to her hands. The biofeedback machine shows Karen how she's doing. The temperature in her hands is rising.
It works wonderfully for me. Before I came, I was having 2 or 3 headaches a week. I probably have one every 2 to 2.5 weeks now, and it's something that I practice regularly.
One has to develop a level of consistent practice with the techniques they learn in order for them to be effective. So rather than thinking in the short term, if I do this for a couple of days a week, I'm going to feel better, one needs to think over the long term. One needs to think about incorporating these techniques that they've learned into their lifestyle.
For people with anxiety disorders, one type of treatment is something called cognitive behavioral therapy. It can be done one-on-one or in a group setting.
My problem sometimes is that same old shoulds. I should be doing this. I don't work.
Simply put, cognitive behavioral therapy teaches people how to change the way they think and respond to stress. This type of therapy is relatively short-term, typically lasting 8 to 12 weeks. Susan has been going to a stress clinic to overcome a fear of embarrassing herself when called on in class. She's learning how to examine her negative thoughts and replace them with more positive ones.
What would be an alternative to the idea that you're going to cry and blush and say the wrong answer and make a fool of yourself?
Maybe I'll have the right answer.
Okay.
Maybe it won't be so bad if I give him the wrong answer. If I'd had this class 2 years ago, I would have dropped it. Just like that. Simple. I don't want to deal with this. I'm not going to put myself through this. Now, I won't like it. I am anxious. I'm uncomfortable. I may make a fool of myself. I may blush. I may cry. Chances are I'm not going to run screaming out of the room. But I can face it. I can expose myself to it. And it gets easier every time.
Using cognitive behavioral techniques may also help some people get through a panic attack, but it may not be enough for people suffering from severe symptoms.
One of the things I do is if I'm feeling anxious and I feel an anxiety attack coming on, is I'll distract myself. Instead of focusing on my body and what it's feeling, I'll start rifling through my purse or doing mathematical problems in my head, just to distract myself. But that's for small anxiety attacks. If it's getting to where you can't go to the store, you can't go to work, you cannot function, I think you have to start thinking about medication.
Because anxiety disorders may be caused by a chemical imbalance in the brain, it may be helpful to take medication to restore that balance.
How long do you think I will have to be on it?
I think we'll have to see. For some people, this may be a lifelong medication. For others, it is a transient therapy.
These medications do not change who you are. And taking them does not mean you're weak-willed. Taking medicine for anxiety is no different from taking it for high blood pressure or any other illness. The classes of drugs you're most likely to hear about are the antidepressants, such as tricyclic antidepressants, SSRIs, and MAO inhibitors, as well as benzodiazepines. Antidepressants may take 4 to 6 weeks to become fully effective. They are not addictive. Benzodiazepines take effect right away and are mildly addictive. These medications can have side effects, which you should discuss with your doctor. Many times they will diminish after you've been on the medicine for a week or two. Some people may start with medications while others start with therapy. Many people find a combination of the two approaches works best. But before starting any treatment, it's important to understand the advantages and disadvantages of each.
And it's like that stress is normal for everybody. And you're never going to be stress-free.
Another part of treatment for many people suffering from anxiety disorders is a support group. Here people share their feelings, problems, and successes with others who are trying to overcome similar problems.
One of the things that this group fulfills is to put together the pieces of a puzzle of how to get well.
Shirley Green was housebound off and on for 20 years because of fear of panic attacks.
There was that article about anxiety.
Initially told that any young woman with 4 children was going to have problems, Shirley was afraid to tell anyone else about how she was feeling.
Every day when I got up, I wasn't sure whether I could make it through the day, and then I thought, well, I must be crazy. And if I told somebody some of the things that I thought and was afraid of, they would say, you are crazy, and that would mean maybe getting put away somewhere.
Shirley started her own support group so others wouldn't have to suffer in silence as she did.
Because of coming here, I was able to hook up with a therapist who was sensitive to the particular needs of stress and anxiety disorders. So that was pretty crucial to my beginning of my recovery.
For me, it helped so much knowing that there were other people there with a similar situation, and knowing how getting tips from them and learning from them.
Our focus is to educate people. And education and information is one of the most important parts of it, because if you know everything that's going on, then you don't have anything to fear.
Report 4. Issues and answers.